yes and no, because we tried this high deductible 5,000 plan, but the reality is we self-insure a portion of that all the way down so that the individuals have a $1,000 deductible. And that means the city pays the last $4,000 as the in-network deductible. So, to answer your question, if we're looking at what the out-of-pocket or the benefits have been for your employees, we've managed keeping those pretty similar over the course of time by self-insuring that higher deductible and reimbursing employees for that difference. So, to continue with that idea, our annualized claims and our health reimbursement arrangement have been for this year $25,000. We told you last year that the city should probably budget about $43,000 for those claims, and you're running significantly less than that. So that's a win. By doing this, by buying a high deductible from United Healthcare or whoever we buy it from, and then self-insuring, we just take a part of that premium savings and then deploy it back to the employees to get better benefits. It saves a ton of money. So the answer is employees have not seen a drastic change in benefits because we do it this way.
Okay, thanks for clarifying that.
Absolutely. Any other questions?
Don, you might answer this on the percentage increase. Does that include the HRA?
It does not. So I'll have to, I got it so late, I wasn't able to run all those calculations, so I will revise that for you. It would be, but, the HRA is the same with no increase. So the percentage, I guess, would answer kind of a strange way. It probably would include the HRA. There's no change to the fees you pay for your health reimbursement arrangement. And the only thing we might want to always account for is the possibility that your claims could run higher next year.
Okay.
Marvin asked for this on that teledoctor, which was started 2 years ago.
Yeah.
The record how many of our employees actually use that.
The record of how many people, and I think you're probably going to talk about this later, Don, but the record of our people that have used the telemedicine, you have that with you?
I may have to pull it up, but we do have significant usage, and we're seeing that go up across the board. Part of the reason why is because when the President of the United States stands up in front of the country and says, use telemedicine to help with COVID, usage goes way up. And so we've just seen those utilization numbers spike significantly this year.
What about around 40% increase this time?
You think it's about 40%?
I just learned.
40% of the employees using it?
Yeah. No, 40% increase.
Oh, 40% increase. It was $2, I think, so.
Let me look here, I have it right here. So we buy 2 kinds of telemedicine. So last year we added a few things. We used to just have primary care telemedicine, which gives the whole household access to the board-certified primary care. We paid a lesser amount, and then more recently we added this behavioral health counseling support service, which I actually think is really useful in these times with COVID and just everything that we're all experiencing, which is kind of like reading a lot of things in our lives. So we pay an extra $1.50 to have free, unlimited counseling support services for the whole household. And so that was an addition we made. So you are correct that telemedicine itself, without the counseling, is $2 for the city, but $3.50 including the behavioral health. And then this year, because of usage going up so much, the 2 combined are increasing to $5.50 per employee per month.
And what percentage per year is that?
What percentage per year is that? Mayor's asking.
Sorry, that probably is 40%. Is that didn't do a full evaluation. This rate increase was distributed to every single employer we work with. And we did an exploration of other viable vendors who can provide the service because we have more than one in the marketplace, but we were not able to achieve any significant savings without giving things up. The big thing being, if we wanted to try and lower this amount, we would have to charge the employees a copay when they use their services. So most commonly, the service charge, ours is $0, so you pay nothing when you use it. But typically, what we see is a $40 charge per visit for telemedicine. So obviously, that would lower the cost, but I just think it doesn't help as many people because unless you have a debit or credit card handy, you can't use the service. So I think that's a barrier that we just try to overcome. So that's why this costs a little bit more than maybe others.
If the employee has used a heavy deductible or a copay on it, they're gonna take off, so it would not benefit us to do that.
No, it wouldn't.
Okay, so backing up to just finish and make sure the health reimbursement arrangement situation, is there any questions? Just stop me, Marvin. I can't hear everyone on the line, so let me know if they have a question.
Okay.
As far as our other benefits are concerned, we have several things that employees participate in. One is the voluntary dental coverage with Guardian. And when I say voluntary, it means that employees pay all of this. So this isn't really a budget item. The government does have a good plan, and this year there are no rate increases on the dental coverage we have and no benefit changes at all. Next, we have life insurance with Mutual of Omaha. This is a really good benefit that the city pays for. Your budget for this is $431 per month, and that's $51.67 annually. There is no rate change on this, so this will be renewing without any rate increase. And the employees have $50,000 of term life coverage. Also, the spouses receive $10,000 of life insurance and children $2,000. In addition to that amount, which is employer paid, we offer the employees the chance to buy additional amounts of life insurance for themselves, their spouse, and their dependents. We currently have 39 employees participating in this plan, and there is no rate change from Mutual of Omaha. The home stretch here, we also offer voluntary short-term disability coverage through Mutual of Omaha. This provides 60% income protection up to $1,500 per week for participants who opt to buy this coverage. And that benefit is paid tax-free to the disabled person, so that's helpful. It also does cover COVID-related disabilities, so leave from work due to COVID. There's no rate change on this plan. And then also voluntary long-term disability through Mutual of Omaha. And this picks up where the short-term stops. And so it provides 60% income protection up to $5,000 monthly. Again, this is paid, the benefit is paid tax-free to the disabled individual. And this plan will pay all the way to age 65 or the person's Social Security normal retirement age. There's no rate change on this item. We've already covered the telemedicine, and then one other service that you purchase along with all the other benefits is program compliance administration. So whenever there is a person who either has a qualifying event that warrants a COBRA notice, or somebody terminates their benefits or employment with the city, there is a notice process that